is insane, and that is the business model of vaccines. That literally is what I just said. It's just, so you're right, it's perverse, but this thing that you're just saying before about like the money men who want to just make money, like, look, we live in a capitalist system where we have tapped into that that self-interest, but we try to harness it for good. So every company has that to some degree. You know, people have that to some degree, but the idea with capitalism is, yeah, but you got to channel that and you got to do good. You got to do a good product. You got to do a good service. You got to do something positive. And if you don't, you'll be held accountable. So it's got guardrails.
Yes.
So, you know, it's because people are like, well, what are you saying? Like people are sitting there in the pharma company with horns and evil. And like, no, they don't have guardrails. And they've gone totally, gone totally off the rail. Do you like my business idea?
It's a great idea. I'll talk to my lawyer first because I don't want to go to jail.
Well, you're right.
I would think in a sane society I'd get locked up for the rest of my life, especially if he killed a bunch of people, and which is really crazy that none of these people do wind up going to jail. They pay giant criminal fines and then they slip away. I mean, look at the Sackler family. They haven't been jailed, right? Wasn't there like they were going to get immunity in favor of like $6 billion or something crazy, but then a judge kind of put the kibosh on that after Painkiller, the Netflix docudrama came out.
Yeah, and then critically too, I would say it's like, remember during the bank crisis, there were the banks that were too big to fail.
Yeah.
So they wouldn't touch those. The Sackler family, to me, it's like the smaller bank that they could. It was bad, but they could sacrifice them. They could sacrifice that pharma company. Are they going to sacrifice Merck, Sanofi, Pfizer, GSK, any of those guys? Are they really going to sacrifice them at the end of the day, no matter how much harm they do? I don't know. It's hard to see it.
Well, listen, I'm glad you're out there, and I'm glad you can articulate these points so clearly and passionately, because people need to hear it. They need to know what the actual data is, what the actual story is about all of it. And it's better for all of us. And as hard as it is, a pill to swallow, people need to get that glass of water and start swallowing.